Thank you for joining us this evening. I want to welcome you to this expert education presentation from the Sashbear Foundation. I'm Doreen Hindman, and I am the Program Manager for Sashbear. The Sashbear Foundation is a Canadian charity recognized nationally and internationally as a leading voice for families impacted by emotion dysregulation, suicidality, and related mental health challenges. We provide family connections groups across Canada. We provide these expert education series presentations and other programming to help provide skills and hope for families. As a registered charity, we always welcome your donations to help us with your work. And remember that you can also choose to become a monthly donor. Just a small regular donation can make a big difference as we continue to provide support, skills, and education for families to support their loved ones. And I would like to welcome this evening our special guest speaker, Debbie Leung, and she is joining us to speak on the topic of rupture and repair in relationships. So let me introduce Debbie to you. She is a registered psychologist in the province of British Columbia, Canada, and there she is the director of Wise Mind Center, which is a psychology clinic based in Vancouver. She provides assessment and evidence-based treatments such as CBT, ERP, and DBT to adolescents and to adults. After receiving her doctoral degree in clinical psychology at Stony Brook University in New York, she completed a 2-year postdoctoral fellowship with Dr. Marsha Linehan at the University of Washington in 2009. And for those of you who don't know, Dr. Marsha Linehan was the person who developed dialectical behavior therapy. So this really speaks to Debbie's clinical experience, because in Washington there she received intensive training and supervision in dialectical behavior therapy and in research on borderline personality disorder. Debbie has offered clinical consultations, training, and workshops in DBT and BPD related topics, both locally, where she resides in BC, and internationally. And she's a faculty member of Behavioral Tech Institute, which is an organization that aims to bring evidence-based interventions worldwide. And Behavioral Tech was also founded by Dr. Marsha Linehan and is known as the body which really ensures that DBT is being offered as an evidence-based treatment in its most effective ways. So with that, I will turn it over to Dr. Leung. Thank you very much for having joined us this evening.
Thank you, Doreen, for this kind introduction, and thanks everybody for the opportunity. I'm very glad to be here. What I would like to do is actually teach, use some of Dr. Marsha Linehan's skills to help guide this presentation, this talk, right? So and so all of the materials that I'm presenting here are based on her DBT skills training handout and worksheets. In particular, a couple of set of skills from the interpersonal effectiveness modules, and I'm going to be also talking about the cope ahead skills from the emotion regulation module. So when do we try to repair a difficult relationship? So in DBT, we try to teach our clients to problem solve, to repair a difficult relationship when the relationship is very important to us, and such as our relationship with a loved one, and when the relationship is not destructive, and there's hope that the relationship can be improved. And it's very important for us to follow our wise mind, for our deep sense of wisdom, and appeal to our wise mind and check in with our wise mind and think about what we want and what we need from this relationship and follow our hearts. So to follow our wise mind, I think, especially from using a problem-solving approach, right, and being dialectical, these are some of the things that I think will be important for us to think about as we think about how to repair a ruptured relationship with our loved ones. So, for example, what are our goals, especially our long-term goals when it's come to the relationship, right? How do I want the relationship to be, like, maybe in a few years, in 5 years, and 10 years, right? So in the long term, and it's also important to consider our objectives, right? Especially, so objectives is more in terms of the short term, right? So when we see, so for example, when we see our loved ones, when we have an opportunity to meet with them, to interact with them, what are some of the specific outcomes? What are some of the things that we need to do in order to help us meet the objectives? And after we consider some of these goals and objectives that we have in our relationship with our loved ones, we might also want to think about how we would want to prioritize them in a particular interaction with this person. And I'm going to, give more examples and talk more about this. So in DBT, many of you may have learned, the Dear Man Give Fast skills if you have already participated in a family connections program. One thing that we actually teach our clients, right, when we are having we're trying to cope with interpersonal challenges, is to think ahead before we have a conversation with someone or we have an interaction with someone. What are our goals and priorities in the relationship? So in particular, there are three things that we ask people to consider. One is, their objective, right? And the other thing is the relationship that they want to have with this person. And the third one is the self-respect. So objective effectiveness has something to do with getting what we want. So we have a goal, we have some objective that we want to get out of the interaction, right, or the conversation. So we could think about, like, if when we consider objective effectiveness, we could think about like how we could effectively assert our rights and wishes, right? When it comes to also, like, how can we communicate effectively our thoughts and feelings and desires, especially there are some disagreement there with our loved ones, right? And sometimes it may has something to do with there's something that we want our loved one to do, right? We want them to do something, and how can we ask them to do it for us or for themselves or for other reasons in a very effective way. Sometimes it also may have something to do with our loved ones asking us to do something for them, right? And that we may not want the request, or maybe we find the request unreasonable, right? So how can we say no in that interaction or in that conversation? Objective effectiveness could also concern, like, resolving a conflict. And this is especially true if, like the last time, for example, you had an interaction, it didn't really, go really well, right? And there's some sort of conflict. And so when you see the person again, right, when you see your loved one again, how would you be able to resolve that conflict? That might be your objective or goal. Something that you want to consider before you go into that interaction. So if getting what you want or having an objective from in that interaction is very important to you, you may want to ask yourself a couple of questions, right? So first of all, do you know what you want? And specifically, what are some specific results or changes do you want from this interaction? So I want to emphasize the word specific. A lot of people, I've talked to a lot of people, and sometimes people think that they know what they want, but when I actually have a kind of more deeper conversation with them, they actually don't quite know exactly what they want. Or sometimes people have a general idea of what they want, but it is hard for them to actually come up with some specific example. So when we think about what we want, I think it would be very useful to be fairly behaviorally specific, right? So let me give you some example. So let's say if you want your loved ones to be, or even your partner, right, to be more respectful, right? So I could, for example, I could ask my partner to be like, I want you to be more respectful. And my partner would probably say, yeah, sure, okay, right? Now, the thing is, though, my understanding or my what I mean by being respectful may be very different than what he thinks being respectful means, right? So, for example, in my mind, right, like, you know, let's say if my partner likes to put his feet on the table, right, and I think that it's not respectful, right, especially like, you know, around dinner time and stuff like that. He thinks that he's just trying to relax, right? So, if I'm not able to communicate that with him, he may think that he may not be able to meet my needs, my request to be respectful, because, you know, he just doesn't know, right? But he might have some other ways of try to, like, you know, show his respect to me in some other ways. So this is something that I would like to encourage you to think about, right? So you could start with something, if there's something that you want from your loved ones, right, to change, right? You could start with something kind of general, but try to come up with something specific in terms of kind of behavior, right? So that they could, both you and your loved one could actually picture themselves in their head mentally, right? Like imagine themselves actually doing it. That would give them a chance to say, yeah, this is something that I could do. No, or no, this is not something that I could do. And actually vice versa, right? If your loved ones have a request for you, right? And so let's say if your loved ones, you know, want you to be like, say, I want you to be more supportive of me. And, you know, I have no doubt, right? Like, you know, chances are you would say, yeah, sure. Yes, I would be more supportive. Yes, I want to be supportive of you. But if there's no discussion about specifically how you could be supportive, right? So in their mind, what's being supportive would mean, it is possible that you know, there could be some miscommunication or misunderstanding, and your loved ones could get disappointed if because you may be doing something that you, in your mind, you're being very, very supportive, and in their mind they don't think that is a big deal, right? So what's being supportive mean? I don't know, giving them a call to check in every month, right? What supportive means, like, you know, I don't know, so sending them some money, right, in their mind, right? Like, you know, every now and then. It really depends, or what it means, like, you know, like helping them to move, right? So just, I guess, my point is that just try to be specific. If you're not clear, just make sure that you ask. The other thing that would be important to ask ourselves, if objective is very getting something from that interaction, from that conversation is important to us, we have to think about, like, what do we have to do in order to get the results that you want, right, in the interaction. Like, what wording, what kind of words would you want to use in your asking? What kind of maybe your body language do you need to do in order to ask very skillfully in a way that would allow your loved ones to take you seriously, take your ask seriously. So another objective that we often ask people to consider is the relationship itself, right? So is your goal, is it important for you to keep and improve the relationship with this person? And if it is, that means that, so one of the things that you want to consider is how to balance your short-term objectives with the long-term the relationship, the relationship in the long term, right? Because sometimes they could be in conflict with each other. So as an example, right? So let's say if your loved ones ask you to do something for them, and it is something that is not within your limits, and you want to say no, right? And but the relationship, you're ready, like, you want to work on the relationship, you want to improve the relationship, right? Or the relationship is already kind of being a little at risk, right, of falling apart. So how can you maybe say no in a way that make the other person know that you still care about the relationship, that that you still love them, and that you still want the relationship to improve in the long haul. So if we focus on a relationship, if the relationship is important as an objective, then we want to be able to interact with our loved ones in a way that they know that you care about the relationship, even if you guys have a disagreement, right, of some sort. And here are a couple of important questions that you may want to ask yourself, right? So as a way to kind of guide your interaction with your loved one in that conversation or interaction. So after the interaction is over, whether you get the results or changes you want or not, how would you want your loved ones to feel about you, right? Based on the way you handle that conversation. And the other thing that you want to think about is, what do you have to do and how should you act in this interaction for you to keep improving this relationship. So the third thing to consider is the before we enter a conversation and interaction with our loved ones, is to think about the self-respect piece, right? How important is it for you to keep or improve our self-respect, for your self-respect, right? So this is about respecting your own values and your own beliefs, right? And this would be, I think it would be especially true for for individuals, for family who, have a tendency or a history of actually just, they just have like little regard for their own self-respect, right? And they just keep saying yes, right, to their loved ones, and in the long run, it kind of hurts the relationship, and it hurts them, right? It hurts the family member, or it hurts the parents, right, the caregivers. So so if the self-respect, right, if you want to improve your self-respect, right, you work on keeping your self-respect, then some questions that you may want to ask yourself is that, after the interaction is over, again, whether you get the results that you want or not, right, or the change that you want, how would you want to feel about yourself based on the way you handle your interaction with your loved ones, right? So when you look back, say, wait, so do you feel that you were acting in a way that actually, you honor, you're being true to yourself, you assert your your thoughts and feelings, and even if there's a disagreement, you're not, you're asserting yourself, right? You speaking your mind in a way that's respectful and effective. And the other thing to think about is, how do you have to say or do in that interaction in order to feel capable about yourself and your effectiveness in your communication. So this is your self-respect, right? And then after you consider these three things, right? So getting what you want, right? Getting your objective met, the relationship, and your self-respect. Then you may want to rank order these three goals, right? Three things. What is the most important thing out of the three, right? Which one is the most important? Which one is the second most important? And which one is the least important? In reality, I think all of these things are, very important, like probably for all of us, right? And, getting these three things. But it might be useful for you to think about, like how to prioritize them, and what may be some potential conflict that might come up as you try to prioritize these three things. And the reasons that we ask people to prioritize them is because, I think most of you have learned the Dear Man Give Fast skills, and based on how you prioritize these three effectiveness objectives, you may emphasize the skills, different set of skills more, right? So if you emphasize more of getting what you want or saying no in that conversation or in that interaction with your loved ones, you may want to emphasize a bit more of your dear man skills, right? So dear man skills is the describing, right, the situation, expressing your thoughts and opinions, asserting for what you need, right, or what you want, what you're asking, reinforcing the other person ahead of time, right, why they should give you, what you're asking, right, and what would be in it for them to give you what you want, and being mindful, right, of your objectives and goals, and appearing confident in your conversation, and be willing to negotiate, right? So that's the dear man skills. Now, if you prioritize more of the relationship, right, maintaining or improving a relationship, then you would want to emphasize the gift skills more. So the gift skills, just quickly, it stands for being gentle, right, in the way you interact, right, and your look, your face, and your body language, right, in your words, being gentle, acting interested in what the other your loved ones have to say. Validate is a key, validating is the key to maintaining and improving relationship. That's a V. And then E stands for using an easy manner. And then if your priority is to work on improving or maintaining your self-respect, then you want to emphasize the fast skills a bit more. So the fast skills stands for being fair, so being fair to yourself and also to your loved ones, and not being overly apologetic, so that's the A. S stands for sticking to your values, so sticking to your own values, right? And T stands for being truthful, so being truthful to to yourself and to the other person, right? And not lying and exaggerating and all that stuff, right? So the dear man give fast skills, and so you emphasize the set of skills based on how you what your priorities are, right? But like I said, in most situations, in most conversations, we would end up probably using all of these skills, right? But you may want to emphasize a set of skills a bit more, right? Especially, so for example, if there's something that you want from your loved ones, right? Or you want to say no to an unwanted request, but the relationship is very important to you, right? And you want to keep improving it, then you may want to bring out the gift skills more, right? You want to really validate, right, why the other person want these things from you, and why your loved one want these things from you, and keeping the dear man, right, like asserting and keep saying no, and being very mindful of the objective. So there are a couple more things that I would like to kind of discuss and share to help you prepare for potentially kind of challenging, right, conversation or interaction with a loved one, right? Especially like there's a history of rupture. So one thing that you may want to think about ahead of time is that, like, knowing yourself, right? Like, what you like, your feelings, your emotions, your thoughts, and your tendency to react to things, and from your past relationship experiences interacting with your loved ones, what could potentially go wrong, right? So based on how much you know yourself and your past experience. Now, these are some of the things that could get in the way of us being skillful when we're interacting with our loved ones. For example, not knowing what to do, right? So we have the intention to improve the relationship, to repair the relationship, but we just don't really have the skills to do it. We just don't know how to communicate ourselves clearly. We don't know how to ask something in an effective way. So we may not know the skill, so that could be factual. And another factor that could potentially get in the way is that perhaps you don't know what you want. So this is something that the point that I was trying to make earlier, right? Like some people think that they know what they want from their loved one, but when I have a conversation with them, try to like kind of get to the bottom of it, they can't really articulate it, right? So if you don't really know exactly what you want, or if you cannot describe it in a behaviorally specific way, so that you could actually communicate that or show that to the other person, then it is probably not very effective to expect that the other person will know what you want and what you want them to do or how you want them to change. Another thing that could get in the way of us being skillful is it could be our emotions, right? So knowing how we feel, especially emotions that could get in the way of us being effective when we interact with our loved ones, would be very useful. So, looking back, is it usually maybe your fear, maybe it's your anxiety? Could it be pride? Could it be like frustration, anger? Could it be guilt, right? Any of these emotions could potentially show up in your interaction, right? And how may they get in the way of you being skillful in the way you communicate yourself clearly? Sometimes we may forget our long-term goals, right? So usually our long-term goals is to have a better relationship with our loved ones. Maybe, for some of us, the long-term goal would be to, okay, well, I'm going to have to listen and trust my gut instinct and have better respect, right? More respect for myself, right? In the long term. Sometimes we forget these long-term goals, right? And for the short-term goals, right? So short-term goals, sometimes, we might get stuck with like, I need to win this argument. I need to defend myself, right? Or I need to kind of appease I need to help, appease to the person, right? And just give in. And so, think about maybe think about that ahead of time, right? Like what are your long-term goals and what are your short-term goals, right? Or maybe in the moment, are there any short-term goals might kind of get in the way, right? In an interaction, get in the way of you being skillful. Sometimes other people, our loved ones, could get in the way, right? So despite our best effort to be skillful and to show them that we love them, that we want to have a relationship, and perhaps they just need time, right? Perhaps they don't want to have be in touch. They don't appreciate the contact, right? Or maybe they have their emotions, in the moment could get in the way, right? They may be loud, they may be angry, they might get defensive, they might get very argumentative. So these are some of the things that we have very little control over in terms of their reaction and their thoughts and their feelings and their beliefs and what they want about the relationship from us, right? And then the last thing to consider, right, that could get in the way of us being skillful when we're with a loved one, it could be our thoughts and beliefs, right? So this is something that you may want to kind of pay attention to, right? Do you have the belief that, for example, they don't deserve my being skillful, right? Like, and this person doesn't deserve me being skillful because they did this and that, right? Or sometimes, it's not unusual for people to think that, well, why should I be the one making the first move, right? Why should I be the one being skillful, right? Like when they're not doing it, I should only, be doing it if they're trying to be nice to me. Certainly, I mean, I'm sure that, we could validate that. And at the same time, if your long-term goal is to have a better relationship, I think somebody will have to, you may have to be the one making the first move, right? Another example of thoughts and beliefs that could get in the way of us being skillful is that, right? Like, for example, if I reach out first, she'll think that I'm weak and she could push me all over again, right? So just kind of check in with our own thinking and belief and see if any of the thoughts, these kind of beliefs of thinking are getting in the way of us being skillful when it comes to relating or repairing relationship with a loved one. Now, once you kind of you have an idea of like, you know, your goals and objectives, right? And when it comes to your relationship, like how to repair it, right? What you want, and you try to reflect on things that could get in the way, right? Could go wrong in your interaction with your loved one, right? If there's an opportunity for you to see them, and to repair the relationship. I think coping ahead, it would be a very important skills to try to implement. So in DBT, what coping ahead is basically is we're trying to use imaginary exposure skills, right, to try to imagine what could be potentially challenging in an upcoming situation, right? And but not only imagining the difficulty, but also imagining how we could cope by being skillful. And so we have to think ahead of time the challenges that may come up, right? So these are some of the things that you may want to think about, right? So, you know, if you imagine yourself like, you know, for example, you know, meeting with a loved one in a coffee shop, right? Or inviting them over for lunch or whatever, right? Or you go visit them at that place, right? And you have a conversation, right? And let's say if there's some sort of disagreement, right? And what are some of the emotions that may come up in that interaction? So how would you feel if your loved one voice a disagreement, right? Or do something that you do not like, right? Or accusing you of doing something or doing something or didn't do something in the past, right? In that specific interaction, what would you be feeling, right? The other thing that you could potentially imagine, right, or to think ahead, right, as a potential challenge is, you know, when you have those feelings come up in that interaction, what are your emotions trying to tell you to get you to do, right? Would you feel like raising your voice? Would you feel like, you know, start lecturing that person? Would you try to like shut down the conversation or try to avoid, right, somehow, right? Would you, you know, become like, you know, or want to be very defensive? Right. And so noticing and you know, and try to think ahead, like what are some of the potential urges? You know, what would you feel like doing if that emotion shows up in that interaction? And then the other thing to think about, to consider is like, you know, again, in that interaction, like if you're feeling this way, having these thoughts, urges, right? What would you feel in your body? Right? Like, would you be feeling tense? Like, would you be like holding your breath? Right? So I know that like when I get stressed, sometimes I forget to breathe, right? So I hold my breath sometimes, right? Would you have a sinking feeling, right, in your body, in your heart, right? Would you be feeling very heavy in your body? And with your heart racing, right? So try to imagine, right, and think, like anticipate what your body sensations, right? What would your body feel as you're having those feelings and thoughts? And then the other thing to you could also imagine, think about is like, what would your facial expression be, right? Would you be frowning? Would you be pursing your lips? And or maybe your loved one's facial expression, right? How would they be like avoiding eye contact with you, right? Would they be like withdrawing and leaning back, right? Or would they be like, you know, moving forward and maybe like holding their fist, right, when they're talking to you? So you could imagine some of these, you know, where there's the feelings and the body sensation, urges, you know, and imagine them as if they're happening right now, right, vividly, right, as if you're having this conversation and these are some of the things that you're feeling, thinking, and noticing, and this is what you are noticing in your loved ones. Now, more importantly, right, with the coping ahead, we want to also imagine specific coping and problem-solving skills that you could use to tackle each challenge in this interaction. So, right, so for example, as you're imagining yourself, like, for example, feeling really angry or feeling really sad that you want to withdraw, right? You could imagine reminding yourself your goals and your priorities in that situation. Okay. And stay committed. Okay, stay committed, right? Like you have to imagine yourself being committed. Okay, I'm committed to working on bettering, right, improving this relationship. My goal is just to, have a nice lunch and then just go home, right? So that I would be able to do this again in the future. My goal is not to try to defend myself, and right, and my goal is not to to finish this meeting with an argument, right? So you have to, or maybe my goal is to maintaining my self-respect. So reminding yourself your goals and your priorities in this situation, and imagine observing your emotions and thoughts, like things that we talked about, we just talked about. Now, also imagine, for example, right, like, and there's so many skills you could imagine yourself doing, but let's say emotions get in the way, right? Or the acting on your emotions in the past have have shown to you, right, that this is like that they tend to get in the way of you being skillful when you interact with your loved ones. Then you could, for example, you could imagine acting opposite to emotion urges and your thoughts, right? If it would be effective for you to do so. Some of you may have learned opposite action before, right? So for example, if you're really angry and frustrated, right, one opposite action that you could do is to try to perhaps, gently avoid, right, by switching topic, right? And maybe say something nice to that person if possible, when you're feeling really frustrated. If you notice that there's a lot of fear or anxiety, but having your self-respect and is very important for you in the long term, right? In the long-term goal. So not giving in, right? Not giving into that, not giving into your loved one's unwanted request, could be very important. So that would be, not giving in when it's goes against your values and long-term goals when you're feeling very anxious, right? You could also imagine yourself taking some deep breaths, right? Especially like if you're imagining yourself holding your breath, right? Having a lot of muscle tension, you try to imagine yourself, right, in that conversation, taking some deep breath, maybe imagine yourself talking slower, right, rather than fast, changing your body posture. If you notice that your body is tense, so instead of like keeping all your tension in your shoulder, you try to maybe drop your shoulder a bit, right? Try to hold your fist under the table, right, and relax your fist, and taking some deep breaths, and imagine yourself talking slowly. So, but basically imagine vividly, not just the challenges, but more importantly, how you would cope in that difficult conversation as if it is happening right now. And it would be hard, right? It could be challenging work. So make sure that you also practice some relaxation after you imagine coping effectively in your head. And so here, that's the coping ahead skill. So, and this is something that a lot of people, like, if you've seen like athletes doing that, like, before they go on to the a game or competition, right? You can see the side of the stadium, right? You see people like, practicing, closing their eyes and imagining all the moves. It's this basically the same theory. And if you are able to cope ahead in before the real interaction, it might prepare you, better able to be skillful when challenges arise in the real actual interaction. So that's all I have.
Best. So Debbie, first of all, thank you so much. What a great summary of skills that are so really, really important for us to be able to use in relationships and to help build trust in our relationships and improve the communication. I have to say, my heart is just breaking as I read some of the questions that have already been submitted, because a lot of people are talking about how they are wanting to have a relationship, but their son, their daughter, a relative is refusing to have a relationship. They've broken off contact and they're not interested in having contact anymore. And so you obviously can't address specific situations, but when, when, for example, a parent is faced with this situation, how do we respond when we've been told, no, I don't want to hear from you, and we still want to be reaching out and trying to reestablish contact with that person?
Mm-hmm. Yeah, that is definitely a tough one. And I mean, I'm a parent myself, so I just can't imagine, right? I mean, it's so sad and heartbreaking, when, I mean, we love our kids, right, no matter what happened, and when they don't want to have contact with us. So a couple of things kind of that come to my mind. I think clinically, what I would suggest is to try it. I think finding the balance of respecting the loved one's wishes, and at the same time, still communicating in a way, right, just to let them know that we're here, that the door is open, right? So and it's it might sound easy, but it's actually not that easy, right? So respecting the person's wish, right? So I think that sometimes, right, like I think out of desperation and anxiety and fear, right, I've seen parents, right, family members, they would actually keep reaching out, right, keep reaching out to even after their loved one said, no, I don't want to hear from you. I think that if that's something that we're doing or we have a tendency to do, I think it's important to notice that. It's important to observe that, and then ask, like, maybe like think about the pros and cons of doing it, right? Uh, and whether, like, and whether actually like reaching out, keep repeatedly reaching out is actually better, it's good for us, at least in terms of effective for us, not only talking about the relationship, but our own kind of self-respect and stuff like that too, right? So, right, and is that going to help us achieve our long-term goals, right? And what are, if I, like, send another text, right? Like I already sent, like, a few texts and messages in the past week or two, right? If I send another one, right? Is that going to help improve the relationship? Is that going to make them hear me more clearly, right? Is that going to make my loved one want to be with me, right? And talk to me? So I would actually try to consider the pros and cons, and now, and at the same time, I think it's very important for us to validate our needs and our desire to still want to maintain a relationship and show that we love them and we're here for them no matter what. So I would still communicate that to the loved ones, but I may want to cut down the frequency. So think about what is it that you need to do, and like what are some, if there are behaviors that you need to decrease, and if there are behaviors that you want to decrease. So you may want to decrease the number of contact, right? And you may want to increase your your respect for your loved one's wishes, and also increase some other skills to help cope with this distress, right? The disappointment and the sadness for yourself, right? So maybe some of the radical acceptance skills, maybe turning your focus on some other important aspects of your life, right? For example, your health, right? Your other relationship, and sometimes one of the things that could get in the way of us being skillful is that, in my slide, is the other person, right? And if they are not willing to respond in any way, it is hard, very, very hard to accept, and at the same time, it will be very important and effective for us to accept. Not for the future, we don't have to accept that they will never respond to us, right? But in this moment, in this time, you know, their choice is to not to have contact, right? So
somebody else is saying, you know, I'm really afraid to reach out because I'm afraid of saying the wrong thing. Maybe it's not necessarily being rejected, but you know, you touched on this a little bit, that we have emotions around this, and our emotions about how we're going to engage can get in the way. So maybe there's fear or anxiety of doing the wrong thing. How do I then, as a parent, manage my own fear and anxiety about doing the wrong thing when I'm reaching out?
mm-hmm. Yeah, I mean, I think that's a good question. I don't know what would be the wrong thing, right? Like, so I think I don't know what that person means by the wrong thing, right? And if we are, I don't think that it could really go wrong in a way if we are only, like, you know, letting the other person know that I'm thinking about you, and I hope you're doing well, right? So now the loved one may react in a way that we didn't expect them to, right? Now, but does it mean that it's wrong? Right. So remember, we have no control over other people, how other people respond or react to, you know, to us, right? To our words, and you know, what we communicate, right? We only could do our best, right? We try to be as skillful as possible. And you know, if you know the dear man give fast skills, you know how to validate, right? You pull all those out and you do it, right? There's no guarantee that, you know, the interaction will go as smoothly as we want, but if we try to be as skillful as possible and speak from our wise mind, and approach the other person, you know, from our wise mind, and it's going to increase the chance that the relationship would improve, right? Or that the loved one would not react in a way that we didn't expect them to. And yeah, and sometimes you also may need to check, right? Again, like, you know, the thinking that something would go wrong. What do you mean, right? Can you write it out? Can you describe that? And is that factual? So checking the facts about some of our worry thoughts or fear thoughts or beliefs could be quite helpful, right? Just because we think that, it doesn't necessarily mean that it's true.
A lot of times then family members, maybe we're not estranged, but it's a relationship that has a lot of tension in it, and what we're receiving maybe as a parent or another family member is a lot of blame or anger. And so can you give us maybe some tips for how do we manage when it feels like this is all that's coming towards us, is blame and anger from the other person?
Mm-hmm. Yeah, that's a very good question. I think that, like, you know, in the spirit of, like, you know, of being skillful, right? And especially when there's a disagreement, right? And I think I always try to start with validation, right? So and try to think about what you can validate, right? And feelings, right? And feelings, we could definitely always, like, you know, validate the other person's feelings, right? And why they feel the way they feel, right? So some of the thinking. So if they think this way, right? If they think that you haven't done this, or you did this, right? And that's why they feel, right, this way, right? You know, that they blame you and they feel angry. We could validate, well, I could see, you know, if you think this, right, I could see why you're feeling angry. So, you know, validating first, right? I think then it also depends on, I think it's also important to think about, like, you know, try not to validate what is not valid, right? If it is not something that, you know, let's say if they accuse you of doing something that you've never really done, I don't think that would be, it would be important not to validate that, right? And I think it's important to describe facts. But sometimes it really depends on, like, what are your priorities and objectives, right? Do you really, you know, use your wise mind to think about whether you want to go into it, right, to talk about, right, because it could easily like turn into like kind of a defense, right? Or do you want to, sometimes, is this something that you could ignore it, right? Because sometimes, you know, with complaints and accusation, it's not like we have to go into it every time, right? Sometimes it might be effective to just kind of ignore it, right? If it especially like kind of attack, right, at times that are not appropriate to address, like Thanksgiving dinner, right? Sometimes, you know, there would be times that it would be appropriate to actually address some of the concerns, right? So, you know, you might want to think about, have you actually addressed, you know, with your loved ones, the accusation, right? If you know, whether both of you, right, the loved one and yourself, were able to describe factually what happened. And so going back to some of the describe skills, right? And you could encourage loved ones to talk about, describe, you know, their thoughts and feelings and things that happened that made them feel this way without using judgmental or extreme language, and then see if you could kind of gain some perspective from, you know, like, you know, from their, right, from their perspective, right, and see if you could find ways to validate that. But more importantly, I would want to know if there's something that the loved ones want me to change, right? And, you know, and if there's something that they want to change, right? I think that going back to using some of the skills that we talked about, right? Like just being very specific, behaviorally specific, describing it, and talk about whether this is something that, what is it that they want you to change, and whether this is something that you're able to give, right, to change. I think that may be useful. Now, of course, I think that going to family therapy could be useful too. Right. Mm-hmm. Sometimes if it becomes like too overwhelming and right and there's too much emotions, I think going to a professional to talk about this kind of stuff would be very skillful, useful.
Right. So how do we build the trust in the relationship so that we can reach this point of being able to have these conversations?
Yeah, I would actually ask the loved one. Right. I think that most of us, you know, right, like, you know, being parents, right, like, you know, if our kids don't trust us, it's not because we had the intention, right, to for them to not trust us, right? Like, it's not that we wanted to do something to make them not trust us, right, to lose their trust. So I would actually try to have that conversation, or maybe with the help of a professional, way, with a family therapist, to talk about, like, what is it that I could do to, you know, for you to start trusting me, right? And be very specific, right? Be very specific about that, right? So, for example, you know, if I tell you, you know, like, if I tell, like, you know, if you tell me that you will show up and you show up, well, then is it something that you know, you're capable of doing, right? So make sure that you would actually follow through, not just because words means nothing, right, if you can't follow it through with actions.
Okay. So moving on, another thing that's coming up quite frequently in the questions is this idea that, you know, we're validating but the other person is not maybe doing their part. I think you sort of addressed this a little bit when you're talking about what are our beliefs or our thoughts.
Yeah, you know what, I think I think it's you have to ask your own wise mind, like, what's your priority, right? Like, if you think that you, like, it's just you give, right, you're not really getting anything in return, then you may, you know, and does it fit your wise mind? Like, what's your long-term goal, right? You may want to now switch the priority. You may want to up your self-respect a bit more, right, and lower the relationship, right? I mean, this is like, is very is you could change that. It's not like, you know, set, right? So you, like, there may be times in your, you know, periods in your life, you may want to up your self-respect and lower the relationship, and you can still do that without actually ending the relationship, right? So it's like, so not going with the all or nothing, right? But being very dialectical and finding that middle path would be very important. And you know, if you want some more validation from your loved ones, communicate that, right? You could try to use your skill, just like, you know, like, you know, just like what you would like your loved ones to do, right? To be skillful, you maybe using a dear man give fast skills, right? Asking for them to like to be more validating, and be able to give them some specific examples of how they can validate you, right? I think that would be important. Sometimes your loved ones may not have the skills to do that, or they may not know how to validate you. Maybe the intention is there, right? But just they don't know how. They don't know how to do it in a way that you could hear, right? That could make you hear. Yeah.
A few people are also mentioning, you know, the loved one is hurting me by the things that they're saying to me as a parent, for example, and yet they don't care. Like, I am expressing the self-respect priority and saying, look, you know, I don't like to be spoken to that way. What you've just done is really hurtful to me. And there's a real sense that the loved one doesn't care, that they're completely indifferent to the pain that maybe they're causing to me as a parent by the things they're saying or doing.
I don't think any skill would like take away that pain, right? Because I mean, how could you not feel pain and disappointed, right? When you're like being skillful and you show your love and this is how, right? This is how, and you're getting this kind of response from your loved one, right? So I would in that situation, I would maybe try to think more about your self-respect, right? So when that conversation is over, right? If you look back, like how do you want to, looking back, how would you want to manage that hurt and in a way that you could, when you walk out from the conversation, you still have your self-respect, right? Yeah, like, you know, I reach out, you know, and they didn't respond in a way that I wanted them to, and it hurts me. And what do you do? How do you react to that hurt? Did you, you know, try to start lashing out? Did you try to walk away? Did you shut down? Right? Did you start crying? Right? So, you know, and or were you able to like, you know, maintain your self-respect and meet them in the eyes, like, you know, and still continue with that interaction, and keep your eyes on the long-term goal. Yeah, this is how my child responding, and it's very disappointing. And you know, but my priority is still in the long term is the relationship. I still need to stay skillful. It is a very tough one. It is a very tough one. Yeah, and then you need to do a lot of things to take care of yourself. I often like, you know, kind of first think about like, you know, what are my values? What are my goals? How do I, you know, how important is this relationship with me, right? For me. And, you know, and then I kind of narrow it down, like, you know, in this specific situation or interaction, what is it that I want? What are some specific outcome, and what do I need to do in order to get that? And be mindful of my emotions, especially emotions, right? Like, yeah, I think for a lot of us, like, it's the feelings, right, and the emotion urges that could, like, you know, kind of get in the way of us being skillful, right? And yeah, and I think, yeah, the coping ahead too, right? Especially like there's a history of difficult interaction. I think coping ahead would be quite useful. And this is like true, I think, whether we're dealing with, I know, our partner or a loved one, or, you know, children or siblings or people at work, right? So colleagues, so.
Okay, thank you. One last, maybe slightly more personal question. Someone has asked for you to tell us what the artwork behind you says. We're wondering if that's a really important and valuable quote, maybe on the wall behind you, that could be helpful to us.
Great question. I never had anyone else. Thank you for having this interest. It says, grateful for the small things, the big things, and everything in between.
Oh, that's beautiful. That's really beautiful. Be
Thank
grateful
you.
for the small things, the big things, and everything in between.
Yes.
Love it. Thank you so much again, Debbie, for having
Thank you,
been with
Doreen.
us today.
Thank you, everybody.
You can tell how really important this was to so many people out there.
Thank you. Have a good night.